Hi everyone, my group members and I will be presenting on Alzheimer's disease. My group members are Enrique Koch, Samantha Quinto, and myself, Dennis Gladden. Lecturer, Mr. Jair Valdez, Institution, University of Belize. If you look on the other side of the slide, it is showing two brain, a sick brain and a healthy brain. The sick brain is showing Alzheimer's disease due to the plaques and the tangles affecting the brain. Next slide.
Good morning, good morning. So here we have what is Golgi apparatus and its function. So the Golgi apparatus is basically a cell organelle as mentioned before. It is found right beside the endoplasmic reticulum. It is a membrane-bound organelle found in the eukaryotic cells, and its main function is to transport, modify, and package proteins and lipids into vesicles to send it to the different parts of the cell body. As you can see on your right, a picture is being shared which demonstrates the Golgi sacs and vesicles. The Golgi vesicles plays a key role here because they sort many of the cell's protein and membrane constituents. They direct them to their proper destination. Next slide.
Alzheimer's disease. Augusto Dieter was the first individual to receive an official Alzheimer's disease diagnosis. Dieter, who was born in 1850, began to develop symptoms of the condition when she was in her early 50s. Alzheimer's disease is named after Dr. Alois Alzheimer. In 1906, Dr. Alzheimer noticed changes in the brain due to a tissue of a woman who had died of an unusual mental illness. In 1906, Alzheimer's disease was first described as a peculiar disease. It is a progressive neurologic disorder that causes the brain to shrink and brain cells to die. It affects the memory, thinking, and behavior. In addition to Alzheimer's, most causes of it is due to dementia. A continuous decline in thinking, behavioral, and social skills that affects a person's ability to function independently. It can seriously affect a person's ability to carry out daily activities.
What causes Alzheimer's disease? It depends on the age of the person, because if you are 65 years plus, you will more than likely have it or develop it. The family history, if someone in your family line had Alzheimer's disease, it can be more than likely passed on to you. If you have a smoking habit, if you have diabetes or high blood pressure, if you also have an unhealthy diet, it is believed to be caused by the abnormal buildup of proteins in and around brain cells. Proteins involved are amyloid and tau. Amyloid, deposits of which forms plaques around the cells, tau deposits of which form tangled brain cells. As brain cells become affected, there are also a decrease in chemical messenger involved in sending messages or signals between brain cells.
Symptoms and signs. Okay, so when it comes to the symptoms, we all know that every disease has symptoms that a person may encounter which can show us that yes, this person have the disease. With that said, here we have several symptoms for the Alzheimer's disease, which includes memory loss. Now, this is the key symptom here because it is the first thing a person with the disease undergoes. Next, after the patient have lost their memory, they have difficulty in remembering newly learned information. People with the disease also face changes in personality and behavior. They have difficulty in completing familiar tasks, and as well as they have speaking and writing problems. Next slide.
The diagnosis of the disease. Doctors use tests to examine memory impairment and other thinking skills, judge functional abilities, and spot behavioral abnormalities in order to diagnose Alzheimer's disease dementia. They also do a battery of tests to rule out any other potential sources of impairment. To diagnose Alzheimer's, physicians may use their medical history, mental status tests, physical and neurological exams, diagnostic tests, and brain imaging.
Prognosis of the disease. It is progressed through different stages, mild cognitive and dementia. Patients with the disease can survive 4 to 8 years following the diagnosis. Depending on their variables, they may live as long as 20 years. It affects people in different ways, making it difficult for medical professions to predict how an individual disease will progress. Next slide. Treatment of the disease. This type of disease does not have any cure that can stop the advance of the disease. However, patients with this disease can involve in physical activities as well as activities of daily living, which can give them beneficial effects. Aducanumab and memantine are medications that is proved for the treatment of this disease, but as mentioned before, it does not stop the disease. Aducanumab is proved to be used for the treatment of mild cognitive impairment, whereas memantine is used to slow the progression of moderate severe Alzheimer's. Next slide, please.
Research of disease. The FDA stands for Food and Drug Administration. The FDA has approved aducanumab for the treatment of moderate to severe Alzheimer's. According to the FDA, this treatment decreases amyloid plaques, which is anticipated to contribute to a decrease in Alzheimer's disease clinical decline. In addition to that, it is the first FDA-approved therapy to address the underlying biology of Alzheimer's disease. Next slide. Conclusion. Without the products that Golgi body typically sends, other cells and organs in the body would not operate properly. Lysomas would not be generated without Golgi apparatus, and the buildup of dead and damaged organelles and molecules in the cell would eventually lead to cell death. In addition, disabling a portion of a brain cells that functions as a tap to regulate the flow of proteins has been proven to trigger neurodegeneration according to a new study. Next slide. That is our reference. Thank you for watching.